Reynoso, and today I'm going to answer some questions about the fetal circulation. In order to answer these questions, first we had to listen to Dr. Andres' class about the topic, and then by understanding the topic and by analyzing the questions, I could be able to answer the following questions. So the first question is about the fetal circulation, and it has 5 statements, and I'm going to say if it's true or false. The first statement says that there are 2 umbilical arteries and 1 umbilical vein. This statement is true because the umbilical cord have 2 arteries that are responsible for carrying out the desoxygenated blood out of the system of the fetus and carrying it to the placenta, and the vein is the one responsible for carrying oxygenated blood to the from the placenta to the fetus. So the second statement says that over 90% of blood passes the liver by the ductus venosus. This statement is false because about 50% of the blood goes through the liver and the rest bypass the liver by the ductus venosus. That means that there is not the 90%, it's just the 50% of the blood that passes liver by the ductus venosus. The third statement says that the foramen ovale divides the left and right ventricle. This statement is false because it divides the right and the left atrium, not the ventricle. So the fourth statement says that the umbilical artery carries oxygenated blood from the placenta to the fetus. This statement is false because, as we discussed in the first statement, is the umbilical vein the one who carries oxygenated blood from the placenta to the fetus, not the arteries. And the last statement of the fetal circulation question is the foramen ovale allows oxygenated blood to bypass the pulmonary circulation, and this statement is true. The foramen ovale is like a little opening between the right and the left atrium, so it allows the oxygenated blood to go through the right to the left atrium, and it will cause a blood mixed. So these mixed blocks can go to all the circulation of the fetus. It has no business to go to pulmonary circulation. Okay, so the next question is about the fetal circulation, but like in general, and it also has 5 statements. So the first statement says that the oxygen dissociation curve of fetal hemoglobin is shifted to the left compared with adult hemoglobin, ensuring oxygen delivery to the fetus despite low oxygen partial pressures. So this is true because the fetal hemoglobin has lower affinity to 2.3 dephosphoglycerate. Because of that, the curve is going to be like more inclined to the left than to the right, as is usual in adult hemoglobin. Okay, so the next statement says that it is the presence of the ductus arteriosus and large pulmonary vascular resistance which ensure most of the right ventricular output passes into the aorta, and this statement is also true. Following the next statement says that the patency of the ductus arteriosus is maintained by high oxygen tensions, and this statement is false because it is not maintained by high oxygen tensions, it is maintained by low oxygen tensions. The fourth statement says that the patency of the ductus arteriosus is maintained by the vasodilating effects of prostaglandin G2, And this one is false because it's not maintained by prostaglandin G2, it is maintained by a prostaglandin E2. Okay, so the last statement says that 2.3 dephosphatidylserate levels are higher in fetal hemoglobin compared with adult hemoglobin. This statement is false because, as we discussed in statement 1, the hemoglobin fetal has a lower affinity to 2.3 dpg. Therefore, the dissociation curve is going to be like shift to the left, like is not in the case in adult hemoglobin, that the dissociation curve is turned to the right. Okay, so the question 3 is about changes at birth include. So there are 5 statements, and we are going to discuss which of these are part of the changes at birth. So the first statement says, of all in pulmonary vascular resistance, this is true because it occurs with the lung expansion. And the second statement says there is going to be a rise in systemic vascular resistance with clamping of the cord. This is also true. Then we have like an increase in hypoxic pulmonary vasoconstriction. This one is false because there is not going to be an increase, it's going to be a. The last statement of changes at birth is that the ductus arteriosus has a closure within 24 hours after birth, and this is false because the process is usually complete within 2 days after birth. So for the last questions, we are going to like classify a list of congenital heart lesions, and we are going to say if there are cyanotic or acyanotic. So we have 5 congenital heart lesions. The first one says ventricular septal defect, and this one is acyanotic. The second one says atrial septal defect, and this one is acyanotic. The third one says patent ductus arteriosus, and this is also acyanotic. These 3 are acyanotic due to either obstructed lesions or to right shunts. And the last ones are tetralogy of Fallot and transposition of the great arteries, and these 2 are cyanotic congenital heart lesions. Okay, so in order to be like a little bit more specific, we can also say that the tetralogy of Fallot is a structural cyanotic congenital heart disease, and the transposition of great arteries are a vascular congenital heart disease. Okay, so by answering the previous questions, I have arrived to the end of my classwork, so thank you.